New data from a leaked Ontario health report paints a grim picture of healthcare in this province. Wait times at hospitals are up drastically from last year and even last month, and doctors are warning if urgent action isn't taken, the system will collapse.
Healthcare performance is continuing its dramatic nosedive and unfortunately is now in freefall.
A stern warning from Liberal MPP and Dr. Adil Shamji, who points to shortages of ambulances to respond to 911 calls, hospitals with nursing vacancy rates of 55%, memos going out instructing hospitals to prepare for ramp downs of operating rooms, and the surge of children being hospitalized.
Against this backdrop, the Ford government continues to insist that it has everything under control, even as things slip further and further out of their grasp.
He obtained a leaked Ontario health report revealing a host of service issues this September when compared to last year. 90% of patients waited 12 hours in Ontario's emergency rooms, up 17%. Once a patient was admitted, 90% of them waited 45.2 hours to complete their visit, up 40.5%. And patients are waiting 90 minutes to be admitted from their ambulance, up 52.5%.
This was the worst September on record, extending all the way back to 2008.
While wait times are at a record high, the overall volume of patients visiting emergency rooms is actually down from last year, 5.1% lower than 2021. Ambulance volumes were also down 1.9%. Fewer people waiting longer. Doctors say this points to a deteriorating system.
We have a major shortage of nurses. That is honestly a disaster. When I go to the emergency department and I see the huge crowded waiting rooms, I see how short-staffed the nurses are. And this is simply unsustainable and it's not safe.
The Ministry of Health is blaming former governments. In a statement, they tell us for 15 years the Liberals mismanaged Ontario's healthcare system. The Progressive Conservatives say they'll add another 6,000 healthcare workers to Ontario's workforce in the next phase of their plan. And this year, more than 12,000 nurses have registered to practice in Ontario, the highest number ever recorded.
We are short 30,000 nurses at this point in time. So, of course, this is falling way short in terms of what we need. And the biggest issue, recruitment is one issue, but the biggest problem is actually retainment.
Dr. Arya tells us one way to retain nurses is to repeal Bill 124, which caps wage increases at 1% annually. For City News, I'm Tina Yazdani.